Pathological anatomy. The problem in the clubfoot is at the talocalcaneonavicular joint. As you know, there's a forefoot, then there's a midfoot and a hindfoot. Hindfoot is actually articulation of between talus and calcaneum, articulating with the ankle joint with the tibia and fibula above. Then there's a midfoot in which there are multiple bones. Like you start from the medially, there's a naviculum, then comes the medial, middle, and lateral cuneiforms, and then you on the lateral aspect you have cuboid, which are actually articulating with the talus. And from then it comes the forefoot, in which you have metatarsals as well as the phalanges. Now the articulation at the midfoot is such that this articulation between the talonaviculum and talocalcaneal joints is where the problem starts to happen. Although it's not exactly clear what causes this talus to maldevelop, but the problem starts with the talus, that the talus goes into actually sort of a plantar flexion, that is goes downwards and rotates medially. When this happens, when the talus has actually gone downward and rotated medially, the talus has to articulate with the calcaneum below, and there are specific areas in which the talus calcaneal articulation is actually taking place, because there is a groove in the calcaneum in which the talus would rest. But if it goes downward and rotates medially, now this articulation would get disturbed. Now what would happen is, if this is the talus and this is calcaneum, it's going downward and going like this would push the calcaneum to go more medially. That's why there's a varus deformity, and it articulates in such a way and it goes into equinus. Therefore, if you can imagine talus going downward and going medially and pushing calcaneum, where would it push? It would push it more outward and goes into lateral rotation. Therefore, you have a varus deformity as well as equinus at the hindfoot. That is the problem is with the mal rotation of the calcaneum and due to the push from the talus above. Once this happens, the talus going medially and downwards leads to actually the articulation with the talonavicular joint goes also medially and downward. And when naviculum is articulating with the first metatarsal, that is why you have a cavus deformity, because the first metatarsal head is more downward and more prominent as compared to a normal foot, in which the talonavicular articulation is adequate and it's actually in its own axis. Once this happens, forefoot goes into adduction. Why? Because the first metatarsal is actually articulating with the naviculum, and therefore that has gone into a cavus. It will go into more of a varus position, and that first metatarsal is actually articulating with other metatarsals. Therefore all the metatarsal go into more medially into a adductus. That is why you see a cavus deformity at the midfoot. On the forefoot you see adductus deformity, and the hindfoot you see equinus and varus deformity. Now if you see, this is what I'm trying to explain. This is the talus. Now if this is a normal bone, this is how it's articulating. This is the talar axis, this is the calcaneal axis, and they're like this. If suddenly talus starts to push downward and medially like this, it rotates downward and medially, if you can see. Now this bone has to give way. This bone just cannot stay in the place. And where would this bone go? The calcaneum. This would rotate in the other fashion, and that is why you have a varus and equinus deformity, because it pushes the calcaneum like this and comes out. And this is what actually starts to happen. When the calcaneum has been pushed outwards, this also pushes the naviculum and all the bones more plantar flexly and medially. And then when this happens, this disturbs the articulation between the naviculum and first metatarsal, and then from midfoot cavus it goes into forefoot adductus. And the pathoanatomy and the pathological anatomy of this disease is such that the problem is with the disarticulation, or the talus hinges over the calcaneum in such a way that it disrupts the anatomy of the osseous bones in the midfoot. And as midfoot, forefoot and hindfoot are actually interrelated, because foot is a propulsive organ, it helps us to move forward. Therefore this forefoot, midfoot and hindfoot are actually acting in a unison. Once the problem starts, the midfoot This leads to problem with the hind foot as well as the forefoot. And this eventually results in a clubfoot deformity, which is primarily midfoot cavus, forefoot adductus, hindfoot varus, and equinus.